everyone, I am Dr. Ravina, NHS doctor specialised in women's health, and I'd like to welcome you to this dedicated channel for women's health, where we aim to educate, inspire and empower women to speak up about the taboo topics affecting their lives. If you're listening to us at Fertility and Femtech podcast, you can also check us out on YouTube at Dr. Ravina, as well as drop me any messages and questions you have either down below or on Instagram at dr.ravina. As always, your questions are confidential and I can't give any personal advice. Please consult with your doctor. Today we'll be discussing breast cancer. Now, breast cancer is one of the most common cancers affecting women in the Western developed world. So what I'd like to do today is teach you how to check your breasts. We'll also be talking about why it's important you do so and when to talk to your doctor about any worrying symptoms. Now, what's really important is that you know what your breasts are like normally. If you know what your breasts are like normally, then if something abnormal happens, you're very aware of what's normal and what's abnormal. Now, what I'd like to do is teach you how to check your breasts for anything abnormal and how to look for lumps. And this is something you can do at home in the comfort of your own home in 60 seconds just by looking at yourself in a mirror. So we'll be teaching you step by step what to do. And then I'd also like to really stress that you should be doing this very regularly. By doing this regularly, you will know what's normal for you and what's abnormal for you. When you go to see your doctor and they check your breasts, they don't necessarily know if you've had a lump there for 5 years that moves around sometimes, comes when you're on your period, or whether this is a new lump. And that's why it's important for women to check the breast so they know what's normal, what's been there for a long period of time, and what's completely abnormal. So let's dive straight in. So here are some statistics about breast cancer. 1 in 4 breast cancer cases are preventable. And in patients with breast cancer, there's a 76% chance of survival more than 10 years, which is quite a reassuring fact, but it does mean that we still need to make some improvement in catching breast cancer early. So step 1, remove your top and your bra and look at yourself in front of a mirror. This is better done standing up, but if you feel more comfortable, you can do this whilst you're lying down in bed or in the shower. The best position to put your hands in is on your hips and then also behind your head. This allows you to see the whole contour of your breast from the bottom all the way up into your armpit. The first thing you're going to do is look. You're going to look at the skin. You're going to look for puckering, for dimpling, any skin changes, and you want to see if there's any rashes on the surface of the skin, as this can identify a type of breast cancer called PAGETS disease. You then want to look at the symmetry of the breast. So the symmetry includes the shape of the breast, the contour, if one looks bigger or smaller, if the size looks completely different to how it normally is, and to see if there's any dimpling of the breast. Next, you want to look at the nipple. Now, the nipples usually look similar. However, if you notice the shape of it change, the direction of the nipple changes. So for example, if it's pointing inwards or outwards, also known as nipple inversion or nipple retraction, then this is also a red flag that you need to notify your doctor about. So first you look. The second thing you do is you feel. So using your right hand for your left breast and also the left hand for your right breast, using your 3 fingers, you're going to use the soft pad on the front of your fingers to press down onto the breast. I want you to imagine your breast being divided up into quarters. So you will have 4 quarters on each breast. This helps you to establish whether you've checked all 4 regions. Once you've used your 3 fingers to palpate or feel in each of the quadrants of your breast, I'd then like you to extend this down towards your armpit. The armpit can hide some lumps and lymph nodes, so it's really important that you check all the way up into the armpit and quite deep into the armpit to make sure that you don't miss anything. Once you've felt into the armpit, I then want you to draw your attention to the nipple. And I want you to feel around the nipple going closer and closer to the areola. The areola is the darker section of the nipple. I want you to look for any inversion or retraction of the nipple. I'd also like you to identify if there's any discharge. You can do this by applying some pressure onto the nipple to see if any liquid is excreted from the nipple itself. If there is any yellow, white or bloody discharge, this is something you need to notify your doctor about. Once you've completed examining the nipple, I'd then like you to use the opposite hand for the opposite breast and repeat the process on the other breast. The key points that I'd like you to take away from this video or from this podcast are, first of all, you should be checking your breasts regularly. And I'd advise at least once a month. You can do this more regularly. Anything less than once a month means you may miss out on key red flags which could show any abnormality in the breasts. The key red flags to be aware of are 1, any change in the size or shape of the breast. Number 2, any new lumps that are abnormal for you. 3, dimpling, change in contour or puckering of the skin, including new rashes. And number 4, any nipple changes, including inversion, retraction, or any new nipple discharge. So if we start on this side, we'll be using our 3 fingers from our left hand to examine the right breast. And we'll be cutting the breast into quadrants. So first, by starting at the clavicle, we'll be starting here and moving across down the clavicle, starting from the breastbone. And we are going slightly deeper so that we can feel underneath the pectoral muscle. And then we get to the breast and we will be doing each quadrant in turn. So starting from the upper left quadrant, we'll be feeling around for any lumps. And then the right quadrant, then the bottom right and the bottom left. And once you've done that, I would then like you to go from, I'm going to turn our dummy to this side. So you're going to go from the bottom and you're going to extend to the armpit and you're going to feel for any lymph nodes. Unfortunately, Anne doesn't have any arms, but we would be imagining that we'd be going underneath the armpits. Once we've done that, we will be feeling for the nipple. So we'll be feeling around the nipple for any lumps, and then we'll be just gently squeezing the nipple for any discharge. So if I show you from the side, you'll only very slightly be feeling the nipple for any discharge. Once you've done that, you're going to move on to this side and examine with the right 3 fingers of this side onto the left breast, and so on. So that concludes today's video on how to do a breast examination. If you have any questions or any queries on how to do the examination, please drop them in the comments below and I'm happy to help. And we'll see you for our next video. We actually have a video with a cancer doctor who talks specifically about what happens next if you find a breast lump. So you can check that out over here. But otherwise, see you next time for our cancer series. Take care. Bye.